Hey everyone, I'm Kanda Kramer. I'm going to give you guys a presentation today about a parent's perspective in having medically complicated children. So let me start my captioning and add you guys or share my screen. Okay, yes. So if you guys need captions, I will edit those and have those available. They may come a day late after I send this presentation. Let's see here. Sorry, I am new to doing this. Okay, so hopefully you can see my screen here. If you can't, I will not know until the end. So we'll just hope. If not, I will email it out so you guys can look at it and split your screens on your own. But so I'm really excited that Mary had me give this presentation again. And I know it's super weird because of all the Corona stuff, but it's a very important thing to me. So it's super close to my heart because I am a nurse, so I worked at St. Vincent Women's in the NICU for 6 years, and then I work now at Ball in the NICU and have for 2 years. And so, you know, my perspective has changed in having kids who are medically complicated, and I have become such a better nurse since I went through all of this. So I'm hoping to give you guys this insight without having to go through this yourself. And I hope you really take what I say to heart. The way that this presentation is going to go is I'm going to tell you a little bit more about me, a history of the boys, and kind of how things transpired from them being born all the way until needing speech and through speech and then up to where they are today. And then I'm going to give you guys some suggestions. That's my favorite part of this discussion. So if I get a little windy in the middle and you're like, oh, this girl sucks, just read my notes in the PowerPoint and you know, come back to me at the end because I really want you guys to gain some perspective from these things. So I hope this is insightful for you. If you have any questions, my notes are down here, by the way, that's why I keep looking down. If you have any questions at all, please email me. It may take me a day or two to respond. My house is like a zoo right now with all my kids home, but my email is in that first slide under this initial, like the opening slide, and it's candakramer1@gmail.com. So please email me anything you want to say. I do save this presentation, so if you have any comments, questions, concerns about the presentation, please shoot those off to me, and I will get back with you as soon as I can, okay? So let's get started here. I think you can see like my entire screen, like all the PowerPoint stuff, so please ignore the fact that I'm not good at IT. Thank God I can save a neonate's life better than I can perform a Zoom presentation. Okay, so let's talk. This is a hilarious picture of me. I was super duper skinny and tan back then and no glasses, so good times, but that truly is me. So this was a feature. It's actually super silly and weird for me to look at, but this was a feature in Peyton Manning Children's Hospital. They did like the people of Peyton Manning, kind of like the people of New York, and I thought it was just really funny, so that's why I added that. But this is me. Being a NICU nurse through my kids having medical issues has been both a gift and a curse. So what I mean by that is it's a gift because I know enough about what's going on to know this is serious, to know these are the kind of the steps, you know, like an overall view. I can speak medical language. So that's been amazing, very helpful, but it's also been a curse because I know just enough to be able to kind of think things through myself and to say, you know, look at my boys and to say, I am going to do this, I'm not going to do this, and this is why. And I have all the medical journals to back it up. And, you know, so there have been some tough spots. And I wanted you guys, even though we aren't able to see each other in person, I wanted you to see me while I give this presentation because I want you to be able to feel what I was feeling from the parent side. So as I said, I go into a little bit of detail about the boys' history, and I really want you guys to try to put yourself in my shoes, have some empathy about this, because as a medical professional, you're going to give advice, you're going to give suggestions, and you're going to hope, and I mean, hopefully you're going to expect that your parents do these things, right? But I'm just telling you from a parent, it doesn't happen like that. Okay. So please stick with me through this, and take as much as you can from this, because I truly have become a much better nurse from this. And I hope that, I hope that having medically complicated kids, I try to always look for like the reason or the why. And I really am praying that by having them and going through these things, I can help others and just telling my story and, um, giving that perspective to medical providers. So, okay, here we go. NICU stay. So here's the boys. They are so sweet. I can't even remember these pictures, to be honest with you. I remember taking them, but I do not remember them looking like this. But precious. Brady is on the top in both pictures, and Briggs is on the bottom. So Brady and Briggs, they're twins. They are not identical, although they look very similar. Once you get to know them, they look pretty different. But okay, so let me just go off my notes. Otherwise, I'm going to get sidetracked and go down a rabbit hole of, I don't know, chatting about who knows what. So, before I get started, one little rabbit hole I do want to go down. See this door? There are 5 people in this house. My family is absolutely nuts. So, at any point in time, my daughter Adley could walk in, my husband could walk in. I have no idea who's going to come through that door. Any of the boys, all of the boys. I have no clue what kind of clothes they're going to have on, if they're going to even have clothes on, what they're going to be drinking, spilling, doing, etc. So, please forgive me. I know everyone's having their own sort of struggles through all of this, but hopefully we can get through this decent. Okay, so here we go, the boys. The boys were IUI, intrauterine insemination. So they literally took my husband's sperm. We're gonna get really close right here. They took my husband's sperm, spun it down, washed it with gentamicin, and literally put it into my uterus while I was ovulating. So all the fertility issues up to that point, the IUI, and basically all, I mean, at least to the middle point of my pregnancy, I was terrified. Okay, so it already starts off on a rocky course. The boys, I had them at 33 weeks and 4 days. I don't know if I already said that. Premature rupture of membranes. So I just stood up one day in the morning and my water broke, and that was that. I had them that day. So the boys had respiratory issues at first. You can see in the picture, they're on CPAP in those pictures, so that's kind of the little snout thing that comes down. And they worked on respiratory for like a week. So they did CPAP, then nasal cannula, really a pretty easy course. It could have been a lot worse. And then after that, they were basically feeder growers. So they had their little NGs, which you can see in the right picture, their little feeding tubes and their mustaches. And so for about 3 weeks, we were in the NICU for a total of a month. We were just working on feeds. Okay, so during this time, there were some issues here and there. Now they did pretty well, and I made sure I told the nurses, I do not want these boys pushed. I don't care if you give them a gavage feed. I do not want them pushed, because sometimes this happens in NICU. If you're going into NICU, you're going to figure this out really quick. And so, but even still, there were some issues. So they had a lot of reflux, which is pretty typical for a preemie. Breast milk was hard for them. So I was pumping and giving them breast milk in a bottle. That was tough because breast milk is very thin, and the formula they were getting to supplement until my supply came in is very thick. So very different consistencies, very confusing, always the same nipple. Speech came in a couple times, evaluated, said they looked okay, pretty typical preemie stuff. They just need to grow, etc. So we kind of did this for those 3 weeks. One of them, Brady, on the top, failed his car seat study. And at that point in time, when we were about to go home, at that point in time, I said, I'm done with breast milk right now. I will still continue to pump. I was pumping like 40 ounces a day. And I will save it, but I want to get the heck out of here. So this is kind of where like my NICU nurse and mom brain clashed. Looking back, that was not a shining moment for me. But I wanted to leave that NICU. I wanted to go home. It was an hour away. I had one baby at home, one baby in the NICU. I had a 7-year-old. Actually, she was 6 at the time, maybe 5. And it was horrible. So it was a very stressful time. I was in pain. I had a C-section with them. I had a spinal headache. I had to have a spinal patch because of the headache. And so it was a nightmare, really, to be honest with you. And so I said, put him on ready to feed, passed his car seat study. He had to stay for a couple more days because he had that little, I think he had a Brady. That's terrible. I don't know why I named my kid Brady, and we use the word Brady a lot in the NICU. Okay, whatever. So he had a bradycardic event. How about that? And so he had to stay a couple more days. They put him on ready to feed. He did beautifully, went home, no problems. When he came home, I was like, and this is like a real eye roll moment, okay? I'm gonna just look down so you don't have to see it. I decided I'm gonna put him back on breast milk. What an idiot. So I did not do it like, I didn't just flip him back to breast milk. I tried to mix, like I would put ready to feed, and then I soon found out that the powder formula was a lot thinner than the ready to feed. So let me say this, if you don't learn anything else today, I want to tell you guys something. Whatever you are preparing in your outpatient or inpatient setting, make sure it is what the patient is going home to. Okay? That's really important. Write that down. Whatever you're preparing in your outpatient or inpatient setting needs to be the exact same at home. You can't prepare ready to feed. You don't prepare ready to feed. You can't give your patient ready to feed in the NICU and then send your patient home on powder formula. You've got to get that same concentration, same recipe in the NICU in powder before they go home on that, because they can have a lot of issues when the ready to feed is like concrete when you dump it and the powder formula is like water. Okay, so please keep that in mind. Okay, so once we got home, I started to try to mix. That was failed. So I knew some stress signs just from working in the NICU. If I was smart, I would have just stayed with ready to feed. I would have gotten a speech eval and blah, blah, blah. I didn't want to do all that. I had newborn twins at home. It wasn't going to happen. So I was mixing, wasn't working. They were stressed. They were coughing, whatever. So I quit doing that. I kept pumping. And then I asked one of my feeding therapist friends what she would recommend, how to get them back on breast milk. She said I would breastfeed, number one. And number two, they're probably getting a drink of formula and a drink of breast milk. So they're getting a thick swallow and then a thin swallow. So it's super confusing to get that. So why don't you do plain breast milk with an ultra preemie nipple? Okay, so this is what I tried, and it worked. It was great. It was beautiful. I could not breastfeed. I could not for the life of me figure out how to get a preemie boy, two preemie white boys on, like, to breastfeed. It was terrible. And the reason I specify white is because white boy babies have the worst NICU outcomes. We call them wimpy white boys, and they truly are wimpy white boys. And so they wouldn't breastfeed. It was terrible. So I decided I wanted to call lactation. I drove to Women's, so an hour and a half each way with two brand new babies to learn how to breastfeed, like twice a week. So that was like a 5-hour commitment each time I did that. It was terrible. So again, more stress building, stress. I ended up calling Ball Memorial here in Muncie and saying, look, can someone just see me for lactation? I want to come in like twice a week, have someone help me put these wimpy white boys on, and then like call it a day. I don't need a whole bunch. And so they said yes. Once I got to speech at Ball, she said, hey, honey. It's still not letting me in. Okay, that's fine. Just take it to daddy. No problem. Okay. Once she got me in, she suggested that I get a speech eval, and, well, that's kind of drama, but switch PCP and get a speech eval. So that's what I did. That's how we ended up with speech in the beginning. Okay, so here we go. These babies are so precious. Oh my gosh, I can't even remember these pictures. So on the left picture, Brady's on the left, Briggs is on the right. On the right picture, Briggs is on the left, Brady's on the right. Okay, so by the time I got to a new PCP, I got a speech eval, they were about 4 months old. So it took a while. And they were doing okay. They were doing their bottles with their ultra preemie. We ended up seeing speech outpatient kind of once she got to know them, figured all these things out, taught me about more stress signs, showed me positioning and all these things. They were about 9 months old. So this stuff does not happen overnight. This took a long time to get here. Okay. So 9 months old. And we decided to do a swallow study at this point. So, it actually worked out very nicely because with doing a swallow study so late, We could evaluate their bottle feeding. We could evaluate baby food. They had just started doing like baby food trials, so we could evaluate baby food. And we could also start to evaluate solids. So a few weeks before the swallow study, we had been practicing like pieces of bread and Cheerios and, you know, all those things that you start with, puffs, whatever. So we could evaluate all these things. Let me back up first and say the reason that we even went for the swallow study. So they were doing well on the bottles. We saw a few stress signs here and there, but overall they were growing. They were happy. They were okay. The only thing was one of them, Briggs. So in the left picture on the right, he's actually the smaller baby. So I don't know why he looks so big there, but um, he was having some respiratory issues. So he was getting sick a lot. He was needing oral steroids, and it just wasn't adding up why he looked so good bottle feeding, but then was so sick. So although he still was happy, he still was growing. And so I was hesitant a little bit. But because we could test so many things in one swallow study, I decided to go for it. So let's see. We did the swallow study. And what we found was Brady on the left in the left picture had penetration, but he would cough, so he would clear. But he did aspirate a few times during the swallow study on all thicknesses. And also, I don't think Brady aspirated the baby food. Briggs on the right in the left picture, who was sick, aspirated all thicknesses. He aspirated baby food, and he actually penetrated a bite of cereal bar into his lungs. So I don't know that he ever cleared it. I think he had residual left over, and with gravity, that residual is going to fall down into the lungs. So we called it penetration, although we knew it was going to end up as aspiration. So I think she called it penetration probable aspiration. I don't know exactly how she labeled it, but anyway, those were the results. Pretty devastating. So I called the doctor called me after he got the results and said, we pretty much need NGs immediately, or feeding tubes. You can see their tubes in the right picture. So you can see them coming out of their nose right there. And then because I'm a good NICU nurse, I have their syringes literally taped with masking tape to the wall. While they ate, they were getting their milk. So that's hilarious. Okay, so they also wanted me to talk to GI for why, you know, why this is happening. So get involved with a specialist, pulmonology, GI, etc. So at this point in time, my opinion for the boys, I'm gonna look and see if this will tell me how long this has been. No, okay. My opinion for the boys at this point was, I'll place an NG. I do not want a G tube. I don't want it. I don't think they need it. They're happy. They're growing. Whatever. So I did. I placed an NG, and it was horrible. It was truly horrible. So I have these skills, right? I'm a NICU nurse. We place NGs all the time. Probably the simplest thing you can do as a NICU nurse is place an NG or an OG. And it was a nightmare to place it in my own kids. Not only that, but they're old. They're 10 months old here. And so to place an NG in a baby like that is, one, traumatizing, and two, they can move, you know. They're not like a little baby who's just like, meh, 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 meh. No, they're moving, they're grabbing, they're putting their hands to their mouth, they're eating. Look, they have food on their plate here. So they're eating, and they have this huge tube on their nose with this big long string, you know. So I had to like tape it to their back when they would be running around, or tape it to their shirt. At night I would have to tape it to their neck and tape it to their shirt so it wouldn't get wrapped around their neck. And it was terrible. Once it got in, they did okay, but they wouldn't keep the tape on. They would pull it, grab it, they would pull it out. I would have to replace it. It was a nightmare. Then, because they were eating, and there's a tube down their throat, they would be eating like peaches, let's say, and they would choke on it, turn blue. I would rip the tube out because I'm like, I'm not doing this, and they would vomit all over the place. So at a certain point, I took the tubes out. I was tired of that. I couldn't do it. It literally was like a weekend. I mean, it didn't even last that long. And I called GI and I said, listen, if you want tubes in these kids, I just took their NGs out. I will not replace them. So if you want tubes, I need G tubes. That was one of the first times I think that I called the doctor and really stood up for myself and my babies. And I think it's really important that if you have patients like this, that you ask them how it's going, because I'm telling you, it was a nightmare. So I placed, at this point, it felt like I was in between the PCP and the speech therapist and the GI doc. And although my speech therapist was communicating with them, I felt like I was the only one in the middle with the boys saying, like, hearing you, hearing you, hearing you, and making the decision. And it was terrible. I didn't feel like I was qualified to make these decisions. And so I just kind of went with what they said. But then once we were doing all this, I'm like, that's it, I'm done. So that's when I called the doctor, kind of placed that responsibility back on him. And honestly, that felt really good. Okay, so within 1 week, the boys had G tubes. They were in the OR for G tubes. During the pre-testing for the tubes, they found delayed gastric emptying. So, and the pre-test is just an upper GI where they have them drink the barium, and then you lay them down in the x-ray machine and they kind of watch the barium empty, go into their belly, empty through into their bowels, and like see that their anatomy is normal so they can place a G tube and etc. So during that, they found the delayed gastric emptying, which is also called gastroparesis. So now the theory was, and I mean, these dudes, you can see them. They hit their milestones. They're happy. They were a little bit behind, but they were also born early, so they kind of just fell into that category of like preemie, or meeting their milestones for how old they really were, their gestational age and not their corrected age and whatever. It was a mess, but they did well. They're not like laying there, they're not immobile, they're doing well at this point. And so no one knows, like, why are these kids aspirating? They're not identical twins. Why are they both aspirating? We don't have a history. And so it seemed very strange. So at this point, once they found the gastric emptying, the delay in gastric emptying, the doctors kind of pinpointed that they thought that there was a delay in gastric emptying, which meant the stuff, the milk was sitting in their belly, which caused them to reflux, because where's it going to go? If it can't go down, it's going to go up. So they're refluxing all the time, and we knew they were doing that, but associated that with also being preemie. But because they were refluxing all the time, their throat was burnt. So when you burn your tongue on pizza or whatever, and you can't really feel that spot, it's kind of numb after that. That would be how they described like how their throat would feel from refluxing so much. So delayed gastric emptying, reflux, then their throat is burnt or injured from all of that, irritated, and then that caused a delay swallow. So if you're trying to swallow on a throat that's numb, you have no clue when to trigger that swallow, right? So that made them delayed globally, just delayed. I think she called it globally delayed swallow. So on both of them. And then that equaled aspiration. So that's kind of why they allowed us to get the G tubes. These boys are beautiful. Like, they're happy, they're fat, so it really was kind of hard to fight for a G tube at this point, even though they were aspirating, which is terrible. But this is kind of why they were allowed to do this. On the right picture, you can see that, first of all, that I'm a psycho, because you see my tape that says no shoes on our mat, please. There's another NICU nurse moment. But you can see their little backpacks. So they had a little feeding tube. Because they had that delayed emptying, we could put their milk on a pump, not a feeding tube. They did have a feeding tube, but they also had a pump. So they had their little pump and their feeding bag and all their tubing like coiled up in their backpack, and then they could just like move around. There was nothing on their face. They weren't choking because there was nothing down their throat. It was actually a very nice transition. I hated taking them to surgery, but we did it and it was beautiful. I'd also like to point out, look how skinny these little legs and boys and faces are in this picture on the left, from the time they had their NGs to their G tubes. Look at those chubby boys. So it's amazing what happens once your food is actually going to your stomach, isn't it? Crazy. So let me get back here. The boys, we did have some trouble with barfing. I say barfing, that's not the medical term, emesis. And so the dietitian wanted 50 ounces per day in this kid. I'm not even joking, you guys. I don't drink 50 ounces a day. I'm not recommending that. That is not healthy. I should do better. But 50 ounces a day, you guys. Look at these tiny babies. I mean, they look pretty chubby, but they're small. Their stomach's probably this big, less, like this big. And they want 50 ounces of fluid in them. So it was horrible. They were just barfing all the time. There were just puddles of formula and milk, and it was disgusting in our house. So I talked to the PCP. I talked to the speech therapist. I talked to GI, and this was a GI dietitian, so they work very closely together. And for the second time, I made my own decision, like when I pulled the tube out and now this, that I'm not doing that. So against medical advice, right? It was very difficult to make because I wanted to be sure they were okay. But what made me the most comfortable was my PCP said, what happens to you when you're dehydrated? You don't cry tears, you poop balls, and your skin looks flaky. You don't have any kind of turgor is what it's called. And your mouth is dry, your lips are dry. So I basically started watching their hydration status. So I'd make sure they cried, I'd make sure their poop was soft, I'd make sure their mouth was wet, their skin had some turgor to it. And that was it. I could only ever get the most I could ever get into these kids. And they used G tubes until they were they still have them, but they used them religiously until they were 2 years old. So, I mean, that's not a lot compared to the 50 they wanted at 10 months old. So, 17 ounces. I don't know if I said that. 17 ounces was the most I could ever get in these kids. And I would watch their eyes. I was taking into consideration all those things. They gained weight. They looked beautiful. All their checkups were great. So that was the second time I had to say, I'm not doing that. And that's a scary spot to be in. Very stressful. Okay. And then just at the bottom it says the doctors added reflux meds and motility meds to help their guts move. Moving along. Okay, so we came to a fork in the road. Love a good cliche. Okay, these are percussion vests. I don't know if you guys are familiar. These are to shake up the secretions in their lungs so that they can excrete them, so they can cough them or sneeze them or however they want to get rid of them. Swallow them back down and poop them, whatever. So over here on the left, they are getting their nebulizer treatments. That's probably albuterol or Atrovent. I don't know. They're on all the respiratory meds. And they have this vest. It literally shakes them. I wish I had a video to show you guys. And then you see another view over here on the right. We kind of had to work from us holding the nebulizer to putting the elastic things around their head. So this was all, these are all things we had to work on. Like for probably a week, I had to work on changing over from me standing there and holding their little treatments. And don't be fooled. This is my husband. I'm sorry. I love my husband. God bless my marriage. But this is my husband holding Brady on the left's treatment over here. That was a rare occurrence. Okay, you guys, I was the one standing there holding them both. So this is a lot on a mom is what my point is. These vests are usually only used for people who have CP, cerebral palsy, or who have CF, cystic fibrosis. So the fact that we were able to be approved for these machines because we were still having respiratory issues, we know they're aspirating, it was truly a miracle. And I have been in tears over these machines because they're so amazing. But anyway, we started to get specialists. So we're getting into specialists. We're still seeing speech once a week, whatever. And then we're talking about volume. With speech, we're working on the Z vibe and just like, muscular things around their mouth. I have one very like low tone kid who almost appears like he has like a tongue, like a child who maybe would have Down syndrome, who has that low tone where their tongue kind of just hangs out. One child who has that, and then my other child, little Briggies, is super tight, uptight sensory. So the Z vibe was sort of a nightmare. Brady loved it, of course, because he had that floppy tongue. Briggs was like, you're not getting even in the same room with that thing. So all things that kind of like build stress. So anyways, we get to the specialist, and we ended up after months, this takes a while, having a 4-way procedure for both to figure out why. So we know they have this gastric emptying and etc., but why? What's happening? So they got bronchs. I spelled that wrong in my notes, sorry. There's an H on bronchs. They got bronchs, they got EGD, so esophagus, gastric, and duodenum, so into their small intestine. And they got a laryngoscopy. I think I say that a little different than some people. Laryngoscopy, I don't know. Anyway, I say laryngoscopy. They got a laryngoscopy, looks up here at their larynx, and they that kind of looks for like a laryngeal cleft. And then they also had PE tubes, so ear tubes placed. Pressure equalizing, if you don't know what PE stands for. Not physical education, although they probably would benefit from that as well. Okay, so at the point they had these bronchs, they were the healthiest they had ever been. Okay, so I go in super confident. I mean, I wasn't excited because this is a surgery, a procedure, you know, this is pretty intense. 4 specialists standing at my child's bedside. Pretty scary, right? But I was confident, you know, I felt like they were going to be okay. They're kind of going to outgrow this and whatever. During the bronch, they pour saline into the bases of your lungs, suck it back up, and then they plate it to see what bacteria grows. It's called a lavage. And there are supposed to be 0 white blood cells in your lungs, right? In the bases of your lungs, 0 white blood cells. That means you're not aspirating. 0 to 10 is acceptable, okay? Brady had 80 white blood cells in the bases of his lungs and grew 2 types of bacteria, an influenza bacteria and a pneumonia bacteria in his lung bases. So at the very bottom of his lungs. Briggs had 800 white blood cells in his lungs. 800. 0 is normal, right? It was terrible. And he also grew a bacteria that causes influenza and a bacteria that causes pneumonia. So terrible, devastating results. The doctor added the vests at this point, so we talked about those. He maxed out all of their medications. So they're on Singulair, they're on an allergy medication, they're on a motility med, they're on a reflux med, they get 6 nebulizer treatments a day, they have inhalers, they have, I mean, the works, okay? Maxed out all his meds, all his nebs, and he basically looked at me and said, you have 2 months to get these dudes healthy, or they go NPO, nothing by mouth. Nothing by mouth. So they're going to have to eat through their G-tube. They're going to have to drink through their G-tube. Nothing in their mouth. I was devastated. At this point, we had worked for like 1.5 years with speech to get these boys to safe oral feeds. And in 2 months, it could be nothing. So it was one of my lowest points, really. I bawled for a very long time after that appointment. Okay, so here's what happened. After I cried, pulled myself up, and oh, the boys didn't care, by the way. They were fine. They have remained healthy. I mean, I say healthy. I mean growing, happy, doing their milestones, doing their therapy. They're very compliant little dudes. They didn't appear sick, which was what was so hard for me and how many, questions I asked. They didn't appear sick on the outside, and then when you go to the inside and their numbers are a mess and they grow all these bacteria, and it's terrible. It's heart-wrenching, really. Okay, so staying stable. Here's what happened. I ended up making a schedule. I wish I could pause you guys. I wonder if I can. Can I pause you? Okay, let me pause this for just a moment. Okay. Oh no, I think it kept recording. Did it? Shoot, I think it kept recording, you guys. I'm sorry. I'll see if I can cut that out. Oh my gosh, my boys are crying at the door. I'm sorry. Okay, I think I only stopped the share and kept the recording. We'll see if I can edit that out. If not, sorry. Okay, so let me show you guys this. So here is, here's their schedule. So I use this schedule to this day, right? I went home, I made this schedule after I was told that, and this is what I use every single day. So these are just things about Briggs and Brady, how to mix their milk, what their thickness is, what they get for meals, things about their meals. So this one's a little bit old, but haven't mastered chewing of meat and sticky foods like peanut butter and refried beans, and I guess that's still pretty accurate. have not mastered taking a bite from a hole, use the gray hand towels for hands and faces after meals because I'm a psycho NICU nurse, sweep after each meal because they eat off the floor, pretty gross, how to give their meds, and then just other things to be aware of. So down here I specify, like, I don't want you to clean my house, but you do need to sweep because they will eat it off the floor and they have aspiration issues. Okay, so that's all for that. Then I have a list of all their therapy up here. I have a list of their like emergency numbers, poison control. Guys, you have to make sure your families have the poison control number. Please make sure of that. Poison control, emergency and non-emergency police number, and then specialists down there, and then all their meds. So these are all of Brady's meds. Can you see? Okay, these are current meds, and these are Briggs meds. And then we have our daily schedule. See, B+B daily schedule. Time and exactly what needs to be done. These are their Shake Fest parameters. Here we are to 8 o'clock in the morning. So this thing's pretty detailed, you guys. It has everything you would need to know to take care of these kids for one day, okay? And the reason I made this schedule is because these kids go to daycare. They also have respite nurses. And I did not want anyone to do anything they weren't supposed to. So I wanted everything to be the same. And really, I'm looking at you, Mom, because my mom would sometimes sneak them a little drink of Pepsi, and I can't deal. So I want the schedule to be the exact same, and I want them to be able to go from home to daycare to wherever, and every day at 11 it's lunch. It doesn't matter if you're at grandma's, daycare, wherever. So they had their schedule. I did have to tweak it a few times, but that really worked for me, guys. So if your parents are having trouble, give them a schedule to follow. You know, just tell them, write out a schedule. If you want, I can email one to them. I can email the boys to them so they have an idea. Reach out to me for that. I'm happy to be a resource for you guys. This is part of what I feel is my calling, you know, to help people, to help families, and to help healthcare providers. So please reach out to me if you need anything like that. Okay, and then at this time when I had the 2 months, I basically ended up keeping them home for the 2 months. So I quit my job. I resigned my position. That was when I worked at Women's. I resigned my position, and I kept them home for 2 months. No, I made no other commitments, no appointments, no nothing. And I just did the schedule every single day. I was psycho about it. At the 2-month follow-up, the doctor said he was prepared to have a really rough conversation with me about going NPO and whatever, but he was happy with the results of what they sounded like, what they looked like, how their growth was, etc. And he would see us again in another 2 months. So I'm pretty sure that was the first time I took a breath in those 2 months. And I will be honest and say this is still kind of where we are. So this was when they were 1.5. And they are almost 3. They're going to be 3 in August, and we're still here. So we see pulmonology about every 3 months, and they kind of just check in. They've had another bronch that was equally as devastating. I think Brady grew 600 white blood cells instead of 80, and Briggs, they couldn't even like plate it out because there were so many. The swelling was down a little bit. I wonder if I can show you. The swelling was down a little bit in their actual tissue, but it still did not go very well. So again, devastating. Let's see. Here I can show you, I'll show you Briggs because this is pretty bad. Okay, so here you can see this thing right here that looks like a pig nose are where his bronchi split. This is his trachea. So I don't know if you can really see, but it's very swollen. You can barely see those tracheal rings. Where the pig nose is, you can see this is very swollen right here. And actually, you guys, this is his epiglottis. So I'm shocked that we could not, these are his vocal folds. I'm actually shocked we couldn't see that epiglottis when he opened his mouth because it was so swollen. And then let me show you his new pictures. Let's see. Briggs. Here he is. Okay. This is, I'm going to save the epiglottis because it's the most crazy. Here is his trachea now. So you can see definite improvement. Right here, you can see those tracheal rings. Here's the pig nose, so you can see that swelling right in the middle has gone down. I call it pig nose, but that's where his bronchi split. I've already said that. And then here is his epiglottis. Can you believe the difference? Let me show you. Look at that. Unbelievable. And then there's his vocal folds. Well, these look like vaginas, but they're not. Okay, here's his vocal folds, and here they are now. Unbelievable, you guys. So so there was progress in the actual tissue. The numbers were horrible. He also grew pseudomonas at the base of his lungs, and so now we're going to be testing for we are going to do additional testing for CF. We're going to do testing for T cell deficiency, and then there's something else maybe called bronchiostasis or bronchioectasis or something like that that they're going to test for as well. So we're still staying in this spot where we kind of go in every 2 months, and it's literally month by month. So here's specialist visits. We're going to go into now like kind of what the day looks like for these boys. So these are older pictures, but here they are drinking and eating on the doctor's table, you guys. We had so many specialist visits. We would probably go at least once or twice a week to Indianapolis for a specialist visit. And those you just get whenever they say. I mean, you can't really say like, oh, I can only come at like 9:37. No, they give you a time. They say you can come at 9 or you can come at 11. Well, both of those are eating times for us. And I cannot get off that schedule because the next bolus is going to be due in 2 hours and they may still be full and then they may be barfing and it can't work. So they're eating in all these places that are not ideal, you know, for a child who aspirates. So this is a real big hardship for me. You know, going to Indy, first of all, it's about a 4-hour commitment to go to one appointment. They can't stack them because their specialists have one appointment. One has one now and one hasn't one in 10 months. So it's just a real struggle. And we would have to pack up. I mean, everything would have to go with us because the schedule did not stop. So the one thing we didn't take was the percussion vest, but we would take all their G-tube supplies, their emergency G-tube kit. We would take their anything for their nebulizer treatments, just everything that they might need, we had to take with us. So it's a lot. And I say us, but I'm meaning me. Okay. So it's a lot. It was a lot to handle. Let's see. Yes. Okay. So here's a list of their specialists. I already kind of showed you guys that. They have 17 total specialists. So if you count Dr. Boo as their PCP, if you count him twice, one for Brady, one for Briggs, and then my daughter has a few specialists as well for some kidney issues. So between them, 17 specialists. You guys know how many reminder texts I get? It's a nightmare. And Peyton Manning is actually on the recording for Peyton Manning Children's Hospital. And every time I hear his voice, I'm like, Peyton, I swear if I hear you one more time. So it's a struggle. I mean, just to keep up with these dudes, you know? So appointments, follow-up suggestions, medication changes. I've never been to an appointment where they've said, everything looks pretty good. See you in 2 months. No, there's always a medication change. They're very good about asking me what medications do you feel work? What medications do you feel don't work? Let's leave it on, but you trial it off. Let's try to wean off this one. What do you think about this? Let's stay on this one. Let's add this one. So there's always a recommendation from every single one of those appointments. You can see here they have Palm, they have ENT, GI, surgery, neuro, urology, genetics, PCP. They also have, there's another surgeon that they go to. Brady had a little trigger thumb, so we've also got him. So it's tough. I did the math, and we spend 171 hours a month in a specialist office with a therapist, with nursing, or in some sort of healthcare, they're overseen by some sort of healthcare professional for 171 hours a month. So you guys, speech therapists, will see them about 1 hour each week, right? Ish. Maybe 45 minutes, maybe 40, maybe 30, whatever, ish. 4 hours a month, you'll see these kids. And for 171 other hours, well, I guess minus 4. So all of those hours, they're with other people, with other suggestions and other things to do and other things to say. So I want you to keep that in mind when you're thinking about patients who might seem non-compliant, who have medically complicated children, or who don't do the Z-vibe when you send that home with them, or whatever the case may be. Okay, treatments per day. The boys take, I pass 20 meds a day. That's total, so 10 each. They do 12 inhaled meds a day, and then 2 percussion vest treatments a day. So an hour and 20 minutes total I spend with them doing like nurse type things. On sick days, it's a nightmare. You can read. Okay. Weekly therapy. Here's kind of the breakdown of who we see. We do get respite nurses twice a week. I recommend if you have families who have children who are medically complicated, please give them resources for respite nursing. It is a huge benefit. It was not easy. We had to go through a few nurses in order to get to some that we like. We have 4 nurses that rotate out for us. They usually do 1 8-hour shift and then 1 4-hour shift. So during that time, I can take a shower. I can revise their schedule. I can call doctors and make appointments. I can go to the grocery. I can go on a walk. I can do whatever I want to do. Okay, hardships. Oh, I did want to mention, and it's down in the notes, they are, so when you're thinking about parents who are non-compliant, what we call them, right? Hey, can you close that door, please? Thank you. Okay, so when you think about how many hours we're spending with people, I have to prioritize, as the parent who's at all these appointments, I have to prioritize for that week what's the most important. So what's going to benefit them the most? If that week it's the Z-vibe, that's what we're going to focus on, or we may focus on that and something else. If that week it's weaning a medication and like keeping my nostrils above water, then that's what it's going to be. And I'm not going to work on the Z-vibe. So I want you to kind of like let that soak in. 171 hours a month. Like do that math and just think about that, because it is such a challenge and it is impossible for me to accommodate all those suggestions. Okay, hardships. Here we go. I'm going to try to go through this quick. I know I'm getting like low on time here. Okay, hardships. So for us, the hardships, and I will tell you guys, we are very privileged. So these are hardships for people who are doing okay, right? People who are not doing okay to begin with, or who are lower socioeconomic status, you've got to be patient with them. You've got to help them. You've got to give them resources, guys, please, because you feel, during all of this, I felt so alone. I felt like I was just doing this by myself. I was making all the choices. My husband kind of got it, but he was also providing our sole income. And so he wasn't really with them all the time. And, you know, so just please, even if just in your head you have a little like spiel about resources, please give your patients resources. It's so important, you guys. Okay, so hardships, broken healthcare system. The providers don't communicate. I saw that all the way through. That we have a speech therapist from Meridian Health, or what was Meridian Health. We have all our doctors at Peyton Manning. We have a doctor at Pavilion Pediatrics. We've got IU Health diagnostics, and they don't communicate. They're supposed to, they don't. So expect people in healthcare expect the parent to explain. I would go into appointments and they'd say, how'd the bronch go? And I'm like, look it up. So not only is that sort of like negligent as far as like the healthcare workers go, but also it's a lot of strain on the mom, you guys, or the dad, or whoever's the main caregiver. A ton of strain to have to say, well, here are the numbers that I wrote down, so please be aware of that. You saw, I've compiled folders and binders. I mean, this is the boys' medical binder. So I have their health histories. I have their respite schedules right here. Like I said, health histories. I have all those numbers. I have things for how to mix their thickened liquids. And it's really helpful. I have all their diagnostics, pictures, and explanations in a folder. So recommend that to them. This doesn't have to be like super amazing resources where they'll get everything they need. No, recommend they just get a binder and put it all together and realize they're going to be so stressed about this, okay? and have them write down questions. So write them down through the week. Just put a piece of paper in your binder, write down all your questions. That way we address everything while we're in our 30-minute, 40-minute appointment. Financially, obviously, I told you we're doing okay. We were a 2-income home with me working as a nurse at Women's. And then at that time, we became a 1-income home. At this time, currently, we're still basically a 1-income home. I work PRN at Ball. I might get 1 shift a week. I might get no shifts for 4 weeks. So it really is a big strain when you are strapped financially. I'm sure you guys, as a college student, you can feel for this, right? It's hard. So, and then on top of having to take care of your kid and all these meds and appointments, and it's a nightmare. Let's see. For a lot of families too, you may find that depending on what your demographics are where you work, but you may find a lot of people are in between. So we're in between. We make too much to get a lot of government assistance, but we don't make enough to really make ends meet. So we really had to search for help. We really had to dig in and find a way to get the help that we need. So help your families do that. Insurance. Okay. If you're over income, if you're under income, you can get traditional Medicaid. That is the way I would go for a medically complicated child. If you are over income, there's a couple of choices. You can choose to work less to qualify. Who wants to do that? I mean, I'm sure people do that, but I didn't want to do that. But then you get no benefits from your job, right? So this is what held me back. So I didn't want to resign my position. And this is why I then sought out a PRN position at Ball, because I get a lot of benefits from my job. And now I don't mean benefits like insurance. I mean benefits like adult interaction. I get a minute to have some self-identity other than just being in my sweatpants at home doing my kids' treatments. So there's a lot of benefits there. And you can also get some help. So encourage your parents to do these things. Let's see. The cost of the boys' equipment monthly for just their G-tube supplies is $1,500 each. So $3,000 I would be spending monthly on their supplies, not working, trying to keep our bills up. We don't have a giant house. This is a 1-story house. It's a 3-bedroom house. 2 kids are in 1 room. We have 2 tiny little bathrooms. And so it's tough. We don't have all that fancy stuff. We're middle of the road and it's still hard. Let's see, the Shake Fest machines are $17,000 a piece. So we needed help with that because we can get a little bit of help. We have what's called the A&D waiver. So we're over income, but because the boys are medically complicated, they can be, it's like disability for adults, but it's called A&D waiver. So they can get that waiver so that we can get a little bit of assistance with renting the pump. So right now we rent the pumps, and our A&D waiver pays for that. Our G-tube supplies, the A&D waiver pays for that. So it is extremely helpful, you guys. It keeps us on our feet. Okay. Delivery of medical equipment and medications. This is a total nightmare. I can go into this with you more privately if you have any other questions. All I'm going to say is tell your families, do not give up. If there is something you need, if there's a mask you need, if there's tubing you need, if there's a syringe you need that they're not giving you, make them give it to you. They have the ability. They need to provide you appropriate equipment for your child. Do not give up. You have to be kind, but do not give up. I've had to go into that probably a million times. So there's that. There's a little more in the notes about that, but I'm not going into that. Okay, getting help. I found a way to have therapy. So a counselor, basically, a therapist who I can Zoom with. So I Zoom with her about every other week, and that has kept me sane. So tell your families there's an opportunity here, even in this time. Remember when we all did the coronavirus and somehow magically everyone could Zoom, right? It was an option. So find a therapist who can Zoom. I can Zoom her at nap time. I don't have to change out of my sweats. I can just get on my Zoom, talk to her, be done. If the boys cry, I can go get the boy, put him right here on my lap while I'm still talking to her. That's given me a lot of peace, you guys. So please encourage your families to get help if they're feeling upset, depressed, whatever. Make sure you offer that to them. And I don't know, your institution may tell you, they may give you a sheet of resources. I don't know, but find it. Find that resource sheet. And if you don't have one, make one. And then making appropriate decisions. So it's hard for you to stand in the middle of that web, right, with your boys and have all these people. I always tell my speech therapist, you have both your feet in your speech world, but I have one foot in Palm, one foot in ENT, one foot in my PCP's office, one foot in all these places, and I have to respond to all those requests. So please be kind, please be patient, and please try to understand. It's really important, you guys. Okay, so solutions. This is my favorite slide because, actually I think the next one is, but these are my favorite slides, and here's why. I do not like to stay in that stuck position, right? I don't like to be like, oh, I hate everything, you know, whatever. No, let's find some solutions. So family and friend support. If your people do not have family or friends who can help them, you've got to offer respite care. I mean, I don't mean you personally. You have to offer them a resource to get respite care. You can offer them the knowledge that there are Facebook groups. So there's tons of GTube groups. There's tons of NG groups. I wouldn't get too far into them because some of the people are a little crazy, but I would offer them Facebook support. Pursue medical insurance options, so give them the number. I'll try to send you guys that number. It's for FAFSA, and just to have that, you know, in the back of your mind. It's the main number they can call. They can give their information, and then they'll tell them. I think under that, I put some more information down there about, you know, exactly what you can get. But I think you can get, if with a child who's medically complicated, I put on here, I think you can get disability checks. We have not pursued that, but I feel like at a time someone called me about that. So it takes a lot of time. It's a big time commitment to give all your information out and to have these people, sometimes they have to come to your house and assess, and I just can't deal with that. But if you need it, you may have to. So let's see, tell companies what you need. Again, do not give up if you need something. I think I gave a few more notes. Mine kind of cut off, but I gave some notes down below. Local help. So here in Muncie, we have WIC. So WIC can help with food. We thickened with food-based products, so I didn't use Thicket or whatever. So we thickened their milk with yogurt and their water with applesauce or baby apples, the baby food. So if you can get WIC, we did qualify for WIC because of the A&D waiver. So if you can get WIC, you can get yogurt on the plan. You can get milk on the plan. You can get baby apples on the plan, and you can get water from your sink. So that really cut down on a lot of our costs, you guys. And so offer these solutions. Let's see. There's also a place called First Choice for Women. You can go and get diapers. There's a huge list of diaper banks. There's a huge list of food banks. There's like food drives all the time. So please find those resources and offer them to your families. Therapy, we already talked about. Take time away. So encourage your family that, you know, if you can do a session without the mom back there, offer it to her. I one time went and got a McDonald's Coke during my session, and it was probably the best session of my life because I just sat in my car and drank my Coke, and it was beautiful. So if you can, do that. If that makes her anxious, then maybe don't do that. But, you know, talk to her about time away. Talk to her about who can help. Talk to her about respite care so she can go to the grocery alone, or just go take a walk. And then give back. I find a lot of joy in giving back. So this presentation gives me a lot of joy. I know you guys are probably like, oh my gosh, land the plane, girl. But this gives me a lot of joy. I've also, any cup that the boys have outgrown, any you know, bottles they've outgrown, I have given them back to their speech therapist. Like, not back because she didn't give them to me, but I've given them to the outpatient place so that they can either give them to families, you know, wash them, obviously gross, wash them and then give them to families who need them maybe, or just use them to try them out during therapy sessions. So encourage your families to give back if that's something they want to do. Okay, suggestions for therapists. If you guys listen to nothing else, please listen to this part, okay? So start with being honest. You have to be honest. Please create an honest space for your patients. So you can start by saying, I want to make sure that we have an honest relationship here. So I'm going to be honest with you and what I think the recommendations should be and where I think your child should be. based on what your PCP has said, etc. And I want you to be honest with me. If something is not working or you didn't try something, that's okay. Let's talk about it so that we can adjust things or make it fit better into your day or get a better schedule or whatever is going to work at home. Whatever you do in the outpatient setting or even the inpatient setting, you're with them for 30 minutes. If that doesn't transfer to home, that's going to be a worthless 30 minutes of your life. And I'm sorry, but I don't like to waste my time. So make it honest. If it didn't work, they didn't try it, fine. One time, our speech therapist wanted us to give the kids water on a spoon. The next week I came in and I was like, I'm sorry, I tried it one time and that's not going to work out for me. So we changed it. We made it different. But because I was honest in saying that, she was like, okay, let's try this instead. And she didn't get offended. It was a good idea. It was, good thought, but it just didn't work for us. Someone else who was an only kid, that may work for them. That doesn't work for twins with a 7-year-old as well. So just be really honest and really try not to judge. It's very difficult. Try not to judge. Keep an open mind. So like we're talking about non-judgmental space, keep an open mind. Think outside the box, I've discussed many things. I can't even think of something right now. Oh, the Z Vibe. So a Z Vibe is like $80, maybe closer to $100. And then you get you have to pay for all the tips separately. Actually, my therapist recommended we get what's called a Quip toothbrush. It's at Target. It's $25. You pay for if you want a refill every 3 months, which is recommended by the ADA, but you pay $5 a month. So $25 to start, $5 a month. They send you a new brush head and a new battery pack every 3 months, and it's exactly like a Z Vibe. So 2 times a day, they're getting a Z Vibe feel in their mouth with their toothbrush. It's magical. It vibrates for 2 minutes, so you know when to stop brushing, and it's just been a really great replacement for what I would have spent $100 or hundreds of dollars on and used just through their infancy, maybe into toddlerhood. So think outside the box. Look up Pinterest, look up things that you can recommend instead. Meet parents where they are, guys. This is so important. Please meet parents where they are. When I told our speech therapist that I didn't want to place a G-tube, I meant it. I didn't want to place a G-tube. And in 1 week's time, I was like, whoops. So then I wanted that, I knew that we needed the G-tube. At another point in time, she recommended that we try free water. I was not okay with that. The boys were choking, coughing. We were trying to do thickeners. We were in the middle of the Bronx and the specialists, and we were getting used to all that. And I was like, no, just no, I can't do it. And she respected that. She was like, okay, let's just do this instead. Let's go down this path. And then a few months later, I was like, hey, what do you think about doing those free water trials? And she was like, yeah, I've been wanting to do that for months, So meet parents where they are. They will circle back around to you if they trust you and if you do not judge them. Make goals and remind parents where they are. This is important. You can even draw it out. So get your piece of paper, say, this is where we are. We're eating by mouth. We are not drinking by mouth. This is where we want to be in 2 weeks, 3 weeks, whatever a shorter term goal is. And then this is where we want to be by the end of speech so they can see where they need to go. Also, have your parents do that. If your parents want to feed their kid by G-tube for the rest of their God-given lives, your speech therapy is going to be a waste of time. And that's when you're going to have to say, what are your goals? And at that point, if it doesn't align with what your goals are or what a normally developing child's goals are, you've got to make the phone call to the PCP to say, look, we're on separate pages. How do you want me to handle this? Okay, so really use your resources. Really dig into each case, okay? Offer your ideal intervention, but give a backup plan. So a lot of the time, Marissa would say, okay, let's switch to a number 1 nipple from the preemie, which is a faster flow. But if you notice a lot of choking, you notice they get tired, they've done a couple feedings great, and then all of a sudden this feeding doesn't look so great, go back to the preemie. It's okay. You can always go back. You can pull back a little bit. And that really gave me the freedom to be like the one to decide. It took a lot of pressure off for me to say, I just could make the choice. Instead of being told what to do, I could decide this feeding doesn't look so great, so let me switch to that preemie like she said. And that really put me at the center of the team, you know, the head of the team, really, I would say. So that is a really good way to connect with parents, to give them these kind of options once they go home. Communicate with other providers. Okay, you guys, this is so important. Please do this, okay? If you have a question for the PCP, do not ask the mother. It is not acceptable. Please make a call to the PCP. If you have concerns, please call the pulmonologist. If you are confused about something or you want to chat with a nurse who is, well versed in those kind of things, please call them. Okay? Do not put the responsibility on the parent. It is so stressful as it is. And it helps so much if you reach out. Like, please just advocate for these parents. It is such a hard life that they live. And, they need someone in their corner. And I think that could be you guys. Okay, that's it. You guys email me questions. This is just funny, making fun sort of Instagram girls who are like, feeling cute, might delete later. So feeling cute might pass my next swallow study. I don't know. But we all know swallow studies are not pass fail. So just a joke. But these dudes are pretty cute. I think we can all learn from them. I hope this has given you a lot of perspective and insight. Thank you so much for the work that you do, have done, will do as a speech therapist. And I really wish you guys the best of luck. And please email me with any questions. I'm really excited for you guys to get this. And I'm happy to chat with whoever wants to chat. So thank you guys so much. Thank you, Mary. Talk to you guys later.